All right, everyone, welcome. For all of you MBBS students out there in your clinical years, we are about to dive into a topic that is just so fundamental for your future. We're going to look beyond the big hospital drama and focus on where most healthcare actually happens. So let's get right into it. We're talking about the World Health Organization's framework for keeping patients safe in outpatient care. So here's how we're going to break this down. We're looking at 5 key areas. First, we'll get a handle on the unique risks you find in clinics. Then we'll explore the main pillars the WHO has set up for a really solid safety system, starting with the overall culture, then the really critical stuff like diagnoses and meds, hands-on procedures, and finally, the human element that honestly ties this whole thing together.
Okay, so let's start with the big picture, the outpatient safety gap. It's so easy to think that the big, scary safety events only happen in an operating room or an ICU. But the reality? It's completely different. Clinics are truly the front line of medicine.
Just think about it for a second. Where do most patient interactions happen? If you're thinking hospitals, well, that's actually not the case. The vast, vast majority of healthcare, everything from a simple checkup to managing a chronic illness, it all happens in ambulatory or outpatient clinics. The sheer volume of patients makes these places ground zero for safety.
Now, what's really fascinating here is how these risks, the ones the WHO points out, are so specific to the outpatient world. I mean, unlike in a hospital, a delayed diagnosis could mean someone's condition gets way worse for weeks before their next appointment. A medication error, it might go totally unnoticed. And that is the specific safety gap this whole WHO framework is built to close. So how do we even begin to fix this? Well, the WHO's very first pillar is all about building a safety culture. And let me tell you, this isn't just some motivational poster on a wall. It's the absolute foundation for everything else. The WHO has a name for this: patient safety governance. The key takeaway here is that this is about a massive shift in mindset. It's about moving away from asking, whose fault was it, and instead asking, why did our system allow this to happen? It's all about creating this proactive, learning culture where every single person feels responsible for safety.
And this slide, it shows you exactly how you do that. It's not some abstract idea. It's about taking real, concrete actions, having clear policies, people who are designated safety leaders, and this is so important, confidential reporting systems. These systems let staff report mistakes or even near misses without being afraid, which gives us priceless data to find and fix weak spots in the system before anyone else gets hurt.
Okay, so once you have that cultural foundation, let's talk about the 2 biggest clinical risks you're going to face in an outpatient setting: diagnosis and managing medications. This is where your clinical smarts have to meet rock-solid safety systems.
This slide lays out the strategies side by side perfectly. Do you see the theme here? It's all about creating reliable, structured processes. For diagnosis, that means using standardized ways of working and having systems that are basically foolproof for tracking every single lab result and referral. For meds, it's about structured prescribing and doing medication reconciliation, which is just carefully checking that our list of meds matches exactly what the patient is taking at home at every single visit. These systems don't replace your clinical judgment. They support it and cut down the chances for human error.
Next up, let's get to the point of care itself, where the hands-on actions you take directly affect your patient's safety. We're going to focus on 2 big areas: safe procedures and stopping healthcare-associated infections. So the WHO gives us 5 critical strategies for infection prevention and control, or IPC, but I really want to draw your attention to number 1, hand hygiene. It sounds so simple, right? But it is the single most effective, cheapest way to stop infections from spreading. In fact, believe it or not, some studies show that just doing this right can slash healthcare-associated infection rates by up to 50%. That's huge. The other strategies are important too. They create a whole defense system, but it all starts right here.
And when it comes to procedures, even the small ones, the principles are exactly the same as in major surgery. Think of it like a timeout, but for the clinic. You have to systematically check you've got the right patient for the right procedure on the right body part. Using simple checklists made for outpatient clinics, make sure these vital verification steps are never skipped.
All right, on to our final pillar, and honestly, this might be the most important one. You can have the best processes and the fanciest technology in the world, but without effective human interaction, the whole thing can fall apart. This is all about communication and getting the patient involved.
So, how do we make our communication safer? We give it structure.
Using tools like SBAR, which stands for Situation, Background, Assessment, Recommendation, ensures that when you're handing off a patient or talking to a colleague, all the critical info gets passed along clearly and quickly. It's all about stopping vital data from getting lost in translation.
Now this is a really powerful idea. The engaged patient is a powerful safety strategy. We have to stop thinking of patients as just passive people we do things to. They're our partners. They are the only person who is there for every single step of their own healthcare journey, which makes them an absolutely crucial layer in our safety net.
And these are the real practical ways you make that happen. The teach-back technique is just brilliant. After you explain a treatment plan, you ask the patient to explain it back to you in their own words. Now, this isn't a test of their memory. It's a test of how well you explained it. When you involve patients in decisions and encourage them to speak up, you empower them to be your partner in safety.
So as we start to wrap this up, here's the most important point. Patient safety isn't just a checklist, it's a system. The WHO framework shows us how all of these pillars, the culture, the clinical processes, the procedures, and the people, are all connected. They weave together to form a resilient safety net. If an error slips through one layer, the idea is that it gets caught by another.
And that brings everything right back to you. Your role in the future isn't just going to be about diagnosing and treating, it's going to be about actively participating in and strengthening this system of safety every single day with every single patient. So as you go forward, I want you to think about this. How will you, personally, contribute to building that resilient net of safety for every patient who trusts you with their care?